Healthcare Week, day number 3 on 1480 WHBC. John Bozico along with you today. And today we have a very special broadcast as we're going to discuss Altman and Mercy working together during the pandemic. These are two of the most important institutions within our community here in Stark County, Altman Hospital and Mercy Medical Center. And today we bring them both together here on this show as part of the program. Really going to be a great day of discussion and a day where we're going to cover a number of topics. And first, as part of today, we're going to bring in the CEO of Altman Healthcare Delivery System, Chris Remark, and the CEO of Mercy Medical Center, Tom Strauss, who both join me right now. Gentlemen, a little bit unique way of doing this virtually like this, but good to see both of your faces and good to have you on today.
Thank you, John. Good to see you too.
It's great to be here, John. Thank you for inviting us.
So, Chris, we'll start with you first. COVID-19 has obviously significantly impacted so many different parts of the healthcare world and hospitals and healthcare systems throughout the country. What are some of the most significant changes that the two hospitals have made in response to the COVID-19 pandemic?
Yeah, I think, this all started, 3 months ago now. And one of the first things that happened, and it was actually working together with the governor and his staff and really reducing or eliminating elective procedures. So those procedures that are not emergent. And that was really in an effort to make sure that we had enough beds if we had an outbreak and that we had enough personal protective equipment. And so we stopped all elective procedures. And, I think both hospitals, if you ask Tom, he'd say the same thing. We went one day from being very full to really emptying out to accommodate any surge of patients. And so that impacted the families, because they may have been scheduled for a procedure and now we had to put that off until we got through the pandemic. It impacted our employees because it really changed the landscape of the hospitals. And so I think that started things rolling, and that really changed the way we operated. Secondly, I think one of the things that everybody had to get used to was how we checked in or how we visited the hospital. We had to reduce the amount of visitors in the hospital, and when they did come, you had to check in, get your temperature taken, you had to be wearing a mask. And so all those changes were really different for people. We both, Altman and Mercy, really embrace the whole idea of the family being involved in the care, and that's been difficult because they can't be as involved now because it's tough for them to be here when we're trying to keep them and our patients and our team members safe. And so I think those are two of the major impacts. I guess the one thing I would say, and thankfully up to this point, is we created all the capacity, reduced the number of patients we had in the hospital through elective surgeries, but we haven't had that surge to where we've had to use all the beds. So that's all the great work the community is doing, and everybody adhering to the idea of social distancing and wearing your masks and those things, all very important to helping us in combating this pandemic.
Bring back in Tom Strauss now, who is the CEO of Mercy Medical Center. And Tom, how have Altman and Mercy collaborated with the local public health departments to kind of make this whole transition through COVID smoother and make things work out here?
Well, John, first of all, let me say that we truly are blessed in Canton, Ohio, to have two wonderful health systems. So I'm proud to be part of Mercy, and we're thrilled to have the collaboration that we've had with Altman as well. One of the things we did do is work very closely with the public health departments. Throughout the pandemic, we've almost been in constant contact with city, county, state health departments for guidance, testing information, and to make sure that we're following the best practices across the state. Actually, starting way back in early March, I think in March, middle of March, the governor and Dr. Acton shut down elective surgeries. And as Chris has said, we saw a significant decline in the volume. But we have participated in routine calls with the Stark County Health Departments to review our COVID-19 testing process, hospital COVID-19 collection sites, communication to providers about the testing process and patient discharge instructions. And I will tell you that we collaborated well about a potential surge. The good news is we flattened the curve. We haven't had the surge that any of us anticipated, and that's a good thing. It's a blessing. But we had a chance that if we needed to, within 2 weeks, we were prepared to stand up 200 beds at the Kent State dormitories. And between Altman and ourselves, Neomed and Kent State, we were ready to go as many as 800 beds if needed. And the blessing is we've never had to do that.
Wow. No, that really says a lot to what's been going on now through the COVID pandemic. We're joined by Chris Remark, the CEO of Altman Healthcare Delivery System, and then also Tom Strauss, who is the CEO of Mercy Medical Center. Guys, we'll go back to Chris here. Many in the community view Altman and Mercy as kind of being the Maslin and McKinley of hospitals and that they're rivals against each other. So how has that relationship kind of changed as a result of COVID-19?
Tom kind of touched on, even though we are in certain instances competitors, the one thing that we have always done, and I think, we took it to a whole new level this time, was collaborate when we have an issue in the community. And one of the more recent actually was infant mortality. The two organizations, along with other organizations in the community, came together to really address the issues around infant mortality, and we've made a real impact there in reducing the amount of infant mortality across our community. And so we have in the past, we've stepped up. This was to a whole nother level, and it started with even just the sharing of equipment and supplies. You hear, I'm sure you hear in the media that there are shortages of testing supplies and equipment that may be needed. And we ran into some of that in the beginning and shared from Altman to Mercy and back from Mercy to Altman when we had a need. And so that started right away. And then right shortly after that, we've had a weekly call. The leadership of the two organizations had a weekly call. In fact, just yesterday, we had our call, myself, Tom, Ed Roth, other members of our leadership teams, talking every week about what's happening in the community, areas that we can work together, sharing ideas on how we can better serve our patients in the community. So it's been we've always had a really collaborative relationship when it comes to working in the community, helping the community. This time, I think we've taken it to a whole new level, and it's been really gratifying to work together to try and solve one of the most complex health issues we've had here in our community recently.
Tom, did you want to add to that?
Yeah, the weekly calls have been very beneficial because what we're trying to do is look at patient counts, look at hospital capacity, communication. So we've implemented a number of policies jointly, including visitation restrictions, employee screening and assessment, employee travel limitations, sick pay policy, return to work criteria for those who are suspected to have COVID-19 or are under self-quarantine, ceasing clinical site experience for students. And we've been able to provide a united front on communication. That's probably been the biggest thing. And in fact, this show that we have today is part of that. We want to try maintaining transparency and clarity and keeping the public informed about what's happening in their healthcare community as a whole, rather than two different systems trying to communicate potentially different and inconsistent advice and information. And probably more than anything, I want your viewers to know that they are safe coming back to the hospitals. We have gone over and above trying to make sure that everything we do is focused on the care of our patients and the care of our employees.
We thank Chris Remark, the CEO of Altman Healthcare Delivery System, and Tom Strauss, the CEO of Mercy Medical Center, for both joining us this morning as part of the program. When we come back, we'll continue the discussion and talk about the nursing wing of the hospitals and how they have been affected by the pandemic and how they continue to press forward through everything that is going on. Stay with us.
So are we out now? Said nurse.
He presents and Doug.
Breathe out and repeat after me. Liberty Mutual customizes your car insurance so you only pay for what you need.
Liberty Mutual customizes your car insurance so you only pay for what you need.
Your bird is eating my candles.
Your bird is eating my candles.
No, seriously, he's making a mess.
No, seriously, he's...
Liberty, 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 liberty.
Get a customized quote at libertymutual.com.
Hey, the Roadman, Kenny Rohde here, and the Wacom Auto family is here to help you get the car you need. There are a ton of great offers right now at every Wacom location: Ford, Kia, Hyundai, Subaru, Mitsubishi, and Honda. And now more than ever, with everything that's going on in our world, it's important to pick a locally owned, family-operated dealership to get your next vehicle. And Wacom has been in the community for more than 75 years, doing business the Wacom way. You can get unbelievable summer savings right now happening on trucks and all-wheel drive SUVs, plus safe cars and great deals for teen and college-bound drivers. Over 1,000 cars in stock, and you can check them out online right now at Wacom.com. In fact, you can get pre-approved online with no social security number needed, no hard credit pull whatsoever. So take advantage of the summer savings and great deals happening on the Wacom Auto Mile, and do what I did and save the Wacom way and tell them the Roadman sent you.
John Bozica back with you on 1480 WHBC as we continue our Healthcare Week. And today we are discussing two of Stark County's institutions and how they've been working together throughout the pandemic, the COVID-19 pandemic, and that is Altman Hospital and Mercy Medical Center combined. They've served us for more than 200 years as a whole, and they have just been instrumental in making our healthcare system here in Stark County work and flow with each and every year. So we go now to a different wing of the hospital, screening, visitation, testing, and we bring in Ann Gunther, who is the Chief Nursing Executive at Altman, and Barb Yingling, who is the Chief Nursing Officer at Mercy. Ann, we'll start with you first. Currently, Altman and Mercy have restricted visitation. Will that open back up in months to come? And when it does, what exactly will that look like?
Sure. Thanks, John, and good morning. First and foremost, as a nurse and leading, a workforce of nursing, we understand the importance of visitation, especially when you're a patient and also when your loved one is a patient in the hospital. And safety is and has been and will always be our number one priority for patients, employees, and visitors. So having to restrict visitation has been very difficult for the patients, for the families, and also for our staff. But we've been following the guidelines and recommendations of our local health departments, as well as the state, and even the CDC. And really, when the pandemic really, started surging, we did limit down visitation, but we actually then really restricted, to almost zero visitation. And I want to just give you a little bit of statistics of that here on the main campus at Altman Hospital. Before COVID, we had over 9,000 people coming through our doors, whether it was employees, visitors, patients. And then once we limited down the visitation, we went to almost 750. So just a significant amount of traffic coming through our facilities. So when we limited it, we pretty much, it was just employees, and then patients that need to come in for services, but it was pretty much, shut down. So we determined visitation basically off of the number of positive COVID patients in our facilities, as well as just exposure risk to everyone. We look at our inventory for our PPE, as well as our testing capability and capacity. So we are now today, actually, we have lifted the zero visitation. Now we do have limited visitation that both hospitals have put into place. But again, it's just number one, safety for our patients and visitors.
We bring back in now to the conversation Barb Yingling, Chief Nursing Officer at Mercy Medical Center. Barb, good to see you this morning. What does a typical screening include for those that might find their way to Mercy?
Yeah, good morning, John, and to all the listeners. A typical screening would include a temperature check as they enter into the building, along with asking some questions about any signs and symptoms in regards to how they've been feeling. We obviously want well visitors to come to our facility during this time period. So those are the things that we're going to be checking in with them. At Mercy, they're going to be receiving a handout when they do come here that'll explain our visitor restrictions. In addition to, we want them to be washing their hands or sanitizing their hands frequently. We also want them to maintain the social distancing that's in place throughout the hospital. We want them also to remain in the patient that they're visiting in their room, unless obviously they need to visit the cafeteria or the restroom. And we're also requiring that a mask be worn by all of our visitors. As we all know from the CDC, that is a great prevention for source control if someone has to sneeze or to cough. So that will be our definite requirement. And masks will be distributed if a visitor arrives at the hospital. If they don't have one, we will be able to provide one for them at the entrances. We're still going to restrict our entrances to just a couple of entrances within the organization to control the visitor restrictions. So the screening's quite simple. Just make sure you come in healthy, and we're going to do a temperature check.
We bring back in Ann now, Ann Gunther, who's the Chief Nursing Executive at Altman. And how are employees being screened, and what happens should, God forbid, an employee exhibit symptoms of COVID-19?
Sure. So employees are required to screen themselves prior to arrival to work at each shift. So that entails the employee taking their own temperature. And this can be done at home prior to their arrival to their unit and area. If their temperature is 100 degrees Fahrenheit or higher, they are required to stay home and get a hold of their primary care physician, and also call the hospital and let them know that they do have an elevated temperature above 100 degrees. If they're already at work, and we do have stations for those employees who don't have thermometers at home, we do have a station where they can take their temperature. And if it's a higher than 100 degrees, they'll be asked to go home. And then our employee health services will then come involved, again, in collaboration with the physician, their physician, as well as the local health department, if testing is needed. As far as looking at if an employee has symptoms or tests positive, again, our employee health services gets involved. Typically, we'll take a 48-hour look back if they're displaying any symptoms, and then we will start assessing, potential employees or patients that may have come into risk. And we have certain risk levels, and that will dictate, a different type of approach. For example, if they're a low risk, we'll ask the employee to stay home, self-monitor, check their temperature twice a day, and then report any symptoms. If there's a high risk or medium or high risk, then we'll ask them again to take their temperature, check for symptoms, and self-quarantine for 14 days from the date of last exposure. So they are followed very closely, again, through our employee health services in collaboration with the health department as well as their primary care physician.
Barb, thanks for that answer. And by the way, thanks to both of you for joining again this morning. Ann Gunther, the Chief Nursing Executive at Altman, and then Barb Yingling, the Chief Nursing Officer at Mercy. Barb, as we go back to you, what would it take for the screening and visitation restrictions to actually be lifted at this point? What's that going to take?
Really just continuing to assess and evaluate the active COVID cases in our county, our region, the state. And basically that's why we're lifting our restrictions today, because as society and the state of Ohio has started to open up, we feel that we're at a place where we feel it is safe to be able to, lift visiting restrictions to just one person per patient during that length of stay. As we go through this process, we will continue to evaluate over the next, couple of weeks to look at, what type of activity there is in the area. We also have to keep in mind that we're focusing on keeping our staff safe as well, and to decrease any exposure to our staff. So we will keep all of that into consideration. That is something that Altman and Mercy have worked together on throughout this whole process since mid-March, when we had to eliminate visitors for the most part. Obviously, there were some exceptions, but we are also involved in calls with the region, the hospital regional area. So we keep very up to date on the activity that's going on in our area. So I just think we need to continue to evaluate, look at the active cases, what's under investigation. Are we going to see spikes in cases? All of that before we can totally lift restrictions.
Very quickly, for both of you, whoever wants to take this question, either Ann or Barb, the testing process, if you would both like to speak on it really quickly. We have about a minute here, so just keep the answers succinct, and I want to hear your thoughts on the testing process for patients.
Well, the testing process for patients is really very simple. It's a swab that looks like a Q-tip, a long Q-tip, that basically has to be entered and swabbed up in your nose. So that is basically the test. It can be uncomfortable a little bit, but in order to get a valid test, we need to make sure that we have a good sample for the test.
Yeah. Mm-hmm. And then as far as taking the sample, both hospitals have capability of testing for COVID-19. So that has been up and validated and online and occurring. However, there may be some situations in which we need to send those swabs out to a reference lab, which we both use the Cleveland Clinic for that. Mm-hmm. But that has been, as far as sending the testing off, and the in-house capabilities, one thing that both hospitals have been struggling with is having the testing supplies. And we continue to watch that on a daily basis. We work with our supply chain leaders in the organizations to source those supplies, but that for Stark County, that has still continued to be a challenge for both organizations.
These two organizations that we're talking with today, they've been serving the community for just about 200 years, and really more than 200 years. That's Altman Hospital and Mercy Medical Center, and we thank them both for being part of this. Ann Gunther, Chief Nursing Executive at Altman, Barb Yingling, Chief Nursing Officer at Mercy. When we come back, personal protection equipment and the supply chain How have these hospitals adapted during COVID-19? We'll talk about it next.
Breaking and trending. Here's why you should listen. Search 1480 WHBC on Facebook.
It's just good.
Find more right now on WHBC.com.
In times like these, you may not be thinking about blood donation, but blood is needed every day by patients facing a range of serious illnesses. If you're healthy, please schedule an appointment to donate by visiting redcrossblood.org.
Liberty Mutual Insurance Company presents and Doug.
Breathe out and repeat after me. Liberty Mutual customizes your car insurance so you only pay for what you need.
Liberty Mutual customizes your car insurance so you only pay for what you need.
Your bird is eating my candles.
Your bird is eating my candles.
No, seriously, he's making a mess.
No, seriously, he's...
Liberty, 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 liberty.
Get a customized quote at libertymutual.com.
This is John Merrill with Verndale's Water Center. If you want the best performance from your water softener, use the best salt, DuraCube. Visit our website for specials on DuraCube, and don't forget to ask us about salt delivery.
Verndale's Water Center. Tap into
WHBC AM Canton, reliable as ever on News Talk 1480 WHBC.
WHBC News, it's 74 degrees. He's a graduate of the former Timken High School. Jeffrey Talbert was named last night the new superintendent of the Canton City School District. He has led the Alliance City Schools for the last 7 years. School Board President J.R. Rinaldi says Talbert was their top candidate in previous superintendent searches until he dropped out for family reasons.
He is committed to moving the great work that our staff and community has put into this, moving it forward and committing to it. He's done that at Alliance, and he said, I want people to be excited to come to work each day.
Rinaldi on Canton's Morning News. Talbert takes over for Dr. Jeffrey Graham, who spent a year with the district. Youth in Canton will have 7 places to go this summer as a part of the annual summer program, thanks to $418,000 in federal funding. That's enough money for 361 young people from low to moderate income households, all the way from ages 3 to 18. They'll develop skills and learn positive behaviors. Social distancing is a part of it too. More on this at WHBC.com. As of yesterday, Ohio's unemployment checks are being sent out thanks to the U.S. Department of Labor. The state is borrowing from the federal government now, setting up a $3.1 billion line of credit. Governor Mike DeWine pointed out that other states are being forced to do the same. Just last week, Pro Football Hall of Fame leadership seemed optimistic about a possible game with 20,000 people in attendance. Governor Mike DeWine took some air out of that football yesterday. The governor was asked about having a full house at Tom Benson Stadium in August.
Having a crowd that size, I think, is highly unlikely. Certainly, it could not occur today. It would be very dangerous to do it today.
The hall, in response, says it has always been their goal to hold events in a safe manner. The state says it's been working with the enshrinement event organizers on the possibilities. Your next news at 11 and when it breaks. For News Talk 1480 WHBC, I'm Noah Hiles.
Your severe weather station, News Talk 1480 WHBC.
Here's your active forecast. Partly sunny and warm today with a high of 82. Tonight, clear to partly cloudy, low 63. Tomorrow, partly sunny, warm and more humid with an afternoon and evening shower or a thunderstorm in spots, high 81. Friday, turning out partly sunny and warm with a shower or a thunderstorm in the area, high Friday, 82. I'm Brian May for News Talk 1480 WHBC.
This is Jerry Snodgrass, Executive Director of the Ohio High School Athletic Association. High school sports are about so much more than wins and losses. The OHSAA promotes education-based athletics, where sports are an extension of the classroom. Our schools all want to win. There's no doubt about it. But at the end of the day, it's all about sportsmanship, leadership, and making certain that academics are a priority. Thank you for your support of high school sports in Ohio.
Provided by News Talk 1480 WHBC.
Trusted, live, and local. Your community all morning long here on 1480 WHBC.
And we return back to Healthcare Week on 1480 WHBC as we come to you live from, well, the studio today of 1480 WHBC, but we're discussing really a myriad of topics with two of Canton's institutions, two of Stark County's institutions, and those are Altman Hospital and Mercy Medical Center, two places that have impacted this community for almost, well, more than 200 years, as we've been saying all morning. We go to our next guest now, and we discuss personal protection equipment and the supply chain, and we bring in Chris Parrish, the Senior VP for the System Supply Chain at Altman, and Brian Conklin, the Director of Supply Chain Services at Mercy. Both of you, thanks for joining me this morning.
Thank you, John.
Thank you.
Absolutely. So we'll start with Chris on the first question here. Can you really start by explaining what is included in PPE or personal protective equipment for those that don't know, Chris?
Sure, John. Thank you very much for the time today as well. So the Centers of Disease Control define COVID-19 personal protective equipment as the following: goggles or disposable fluid face shield, NIOSH approved N95 filtering face piece respirator or higher level, a reusable or disposable gown, and then a clean, non-sterile pair of gloves. Now, the other thing, in addition to these items, this pandemic has created a shortfall in supplies when it comes to items that we've designated as critical items during this COVID crisis. Things such as hand sanitizer, disinfecting wipes, IV tubing, respiratory therapy equipment, ventilators, digital thermometers, visitor face masks, COVID testing materials, and so forth. And one of the things as an organization, as part of the community, we want to thank the community. During the initial onset of COVID-19, we received donations from over 71 individuals and organizations across the community when it came to these personal protective equipment items. And we want to thank all of the individuals that took part in that donation process, as well as the people that we put to work really creating cloth masks for us. Over the course of this COVID crisis, we have had individuals from our community produce over 21,000 cloth face masks for our staff and people here at our organization. So I want to thank all of those individuals personally for all of the work they put forward to helping us in this crisis situation.
It's pretty amazing the way that the community has responded to all of this, Chris. I'll say that that's been a big thing from the get-go. Brian, to bring you back into the conversation, early in the outbreak, there were many news reports that there were shortages of PPE and different things like that. Did you ever feel that Altman or Mercy were running out at any time? And if so, I mean, what steps did you take to prevent that from actually happening?
Well, initially, I had an idea of which supplies we would need. Wasn't sure how many we would need or what we would go through. We've seen news stories of hospitals running out of PPE right away. We knew we had a substantial inventory that was created by our emergency preparedness team. So I don't feel like we were ever at risk of running out. What we did to ensure that was we had already increased our inventory to prepare for the flu season, which we normally do. Then we also went and met with our distributor to increase our inventory levels of PPE before they went on allocation, which happened to every hospital throughout the country. And then soon after that, we started getting donations from the public. We had a couple organizations donate N95 masks. We had several people, like Chris mentioned, donating cloth masks. We're still getting those donations today. So I think that's how we prepared, and I don't think that we were ever really close to running out of anything.
Chris, I wanted to ask you, are hospitals going through more PPE now than before the outbreak? Is that the case? I mean, is it at a higher rate now?
Yeah, John, definitely. When we placed the suspected patients, either suspected or positive COVID patients, into isolation, that creates a whole nother level of supply utilization than what we're used to. During flu season, we'll see an increase in a lot of that personal protective equipment, but not to the level that we've seen with COVID. Every time a provider enters and exits a patient's room, they do what we call donning and doffing, or taking on and taking off that equipment. So very difficult to keep up with those levels as we move forward. In addition to that, if you look at our overall population in the hospital, we're requiring every employee at the hospital to wear a face mask when at the organization. So normal people like our maintenance staff, our housekeeping staff, our people all over the hospital are wearing personal protective equipment that they didn't necessarily wear in the past. In addition to that, every time one of our suspected or positive COVID patients leaves their room and goes for a testing procedure, whether that be imaging or EKG or so forth, all of the people that come in contact with those patients during their transportation process are wearing full personal protective apparel equipment. So definitely an increase we've seen over the past several months in utilization practices for our PPE.
Joined by Chris Parrish, that's who you just heard right there. He's the Senior VP of System Supply Chain at Altman, and then Brian Conklin, who is the Director of Supply Chain Services at Mercy Medical Center, who is back with us now. And Brian, what are some of the processes that you've gone through to allow people to more efficiently use and then in turn reuse PPE?
So, initially one of the things that we were concerned about was the availability of N95 masks. And, right away we started getting quotes for $9 a mask. And so we were hoping to avoid that, and we did. But we soon discovered that we could reprocess the N95 mask up to 2 times with the sterilizer that we own here. And there were some outside services, Battelle in Columbus was another one that we considered, but we do it on site. And so that triples more or less our inventory of N95 masks. We can also do that with goggles. So that helped extend the life of the N95, which is probably one of the more important pieces of PPE. Then the other thing we did was the CDC made some recommendations for extending the life of PPE, and we implemented those recommendations. And then again, we use donated products to fit people that weren't directly involved in patient care with a dust mask and cloth masks. And we're still doing that today.
I was going to say, Brian, getting your hands on one of those N95 masks if you weren't inside a hospital, it's been like getting your hand on like gold during the gold rush of the old days, from what I've kind of been told. Chris, are you concerned at this point about running out of PPE in the future? Is that a concern of not just these hospitals, but really all healthcare industries right now?
I think, John, we're always going to be at risk. These surge numbers that we see, obviously, in the situation that we were looking at originally with the surge numbers and then what they're anticipating for the future, we have to keep it top of mind. I think what this has caused us to do, as Brian mentioned, a lot of our routine vendors put us on allocation for our normal supplies of PPE. It's caused us to look outside of our normal supply chain into some of these secondary and tertiary vendors. And what we've done is we've been able to create a better link with some of these third-party vendors to allow us access to PPE from areas that in the past we just didn't have that capability. So I'd say we're prepared, John. We're also working very closely with the state on a regional stockpile. In addition to supporting our hospital and Mercy and Altman together, we need to also look at our congregate care facilities in the region. And I think with the OHA designation of stockpiles, we're working together to make sure that we have not only enough supplies on hand to take care of our patients, but also to take care of the community in general in a surge situation, should it be in a nursing home or one of the jails or so forth, that we have a congregate care setting with a surge. We need to be ready to help them out as well.
Brian, would you like to add to that?
So yeah, we are also working with third-party vendors We are not able to get, an adequate supply from our current manufacturers and distributors. And we've begun that process. We've vetted those companies. We've used the support of our GPO, Group Purchasing Organization, to help vet these vendors. There were several hundred vendors that were approaching us, and I'm sure Altman, to sell us supplies. And these were companies that were in business for 2 weeks. And so we've done a good job of vetting out those vendors, and we've selected a few to go along with our current manufacturers. And I think we're set for anything that would come our way.
Chris Parrish joins me, as well as Brian Conklin. Chris is the Senior Vice President for the System Supply Chain at Altman, whereas Brian is the Director of Supply Chain Services at Mercy Medical Center. Both of you, thanks for being part of the program this morning as Health Week rolls on 1480 WHBC. We combine these two great institutions that have been part of Stark County for so many years. And when we come back, we'll talk about how they're keeping you safe through cleaning, sanitizing, and even using robots to be a part of that process. That when we come back on Healthcare Week.
The year was 1907. Here in Ohio, school administrators came together to form the Ohio High School Athletic Association. One thing that hasn't changed since 1907 is the dedication of the OHSAA to education-based athletics in Ohio.
This is Jerry Snodgrass, Executive Director of the Ohio High School Athletic Association. Thank you for your support of high school sports in Ohio.
The OHSAA seeks to prepare students not for the next level of sport, but for the next level of life.
Provided by News Talk 1480 WHBC.
Want to turn your old, rusty hunk of junk in for a nicer ride, but think it's not even worth a tank of gas? Think again. Progressive Jeep Ram will give you $5,000 for your trade, no matter the condition. That's right, $5,000 for any trade, guaranteed. When you buy any factory-certified pre-owned car, truck, or sport utility at Progressive Jeep Ram in Massillon. Needs repairs?
Renovations 1 star. He kept asking me what's behind the walls down there. I'm like, why? What do you know?
No matter how hard you work for your small business, online reviewers will find something to complain about.
And then he's like, you can trust me with the job. And I'm all like, trust?
And while Progressive can't save you from these trolls, we can help you save money on commercial, auto, and business insurance.
Yeah, he charged me less than he said he would, which is lying.
Get a quote online today at progressivecommercial.com. Progressive Casualty Insurance Company, affiliated in third-party insurance.
Napa know-how.
Get all the quality parts you need at your locally owned Napa. Because right now, when you order from Napa online, you can pick up curbside at your local store in just 30 minutes. Or get your order delivered direct to your door with free one-day shipping on over 160,000 quality parts when you spend $50 or more. Quality parts delivered quickly and safely. That's Napa know-how.
Napa know-how.
At participating stores, standard ground shipping and exclusions apply.
And we return back to 1480 WHBC as part of Healthcare Week here on 1480, a week that we do every single year. And today, really a special day, kind of a landmark day, if you will, for the station to be part of something since we've been a fabric of the community for so long, to have the opportunity to interview individuals who have been working hand in hand from both Altman Hospital and Mercy Medical Center as trying to, I guess, kind of solve the problems of COVID-19. It's been a tough time for the healthcare industry, no matter where you are. And right now we're going to go into the idea of keeping you safe through cleaning, sanitizing, and even the use of robots. As I said before, we bring in Lori Murtis, who is the Chief Quality Officer at Altman, and then Dan Lane, who is the Director of Quality and Risk Management at Mercy. Both of you, thanks for being part of the show this morning.
Thanks for having us.
Yeah, thank you.
So first, we'll go to Lori. What are some of the changes that have been implemented to protect patients during this pandemic, Lori?
So if you heard earlier, as Chris and Ann and Tom and Barb spoke, we had to reduce our visitation. We wanted to decrease the number of people that were coming in that could potentially have it or be exposed to it. So we did the screening at the doors. We screened visitors and employees and staff, as well as outpatients who still might need to come to the hospital to get their tests completed. It also included decreasing the number of people who were entering the facility, such as vendors, and we moved a lot of employees to work from home so that they wouldn't have to come in and cause increased risk. We expanded the frequency of our cleaning programs with an emphasis on high-touch surfaces, and with that, you continue universal precautions, but we added the addition of masks. So universal precautions are washing your hands. If someone is in isolation, you make sure that you have the appropriate isolation equipment on for whatever type of isolation they're in. And we were also able to close some areas in the facilities where there was decreased traffic, and that allowed us to be able to concentrate our EVS staff to be able to work in areas where we did have occupancy.
Dan, we bring you back in, Director of Quality and Risk Management at Mercy Medical Center. What steps have you taken to clean, then disinfect and sanitize patient rooms during the pandemic? Because I know there's so many people that are scared to even go to the hospital for this very thing right now.
Right. So in both hospitals, we've taken numerous steps to make sure that our patients are safe and that those rooms are getting cleaned. Both hospitals have great EVS staff. They're able to take care of cleaning the rooms. So we made sure that they were cleaning the high-touch surfaces, Lori said. So those are surfaces that are touched a lot during care. Bed rails, doorknobs, light switches, handrails, telephones. Make sure that all those areas are cleaned more frequently. Making sure that the cleaner is actually good for coronavirus. Not all cleaners could kill coronavirus, but fortunately, we all have products that do that. Also, then we make sure that employees are using hand hygiene and washing their hands and using the Purell stations around the hospital. And then we also have electrostatic spray guns. So there's sprays that come electrostatically charged that grab the surfaces to help clean surfaces where you can't usually use cleaning products. So we have all those things in conjunction to help make sure that the room is clean and sanitized. After each patient is discharged in a COVID positive room, we make sure we bring the robot in there and zap those rooms to make sure that they're actually then very clean for the next patient.
So they're actually using robots. They're using skilled robots that come in and clean rooms. That's just fascinating to me. It's not the first time that we've heard that during Healthcare Week this week. Lori, we go back to you. Lori Murtis, the Chief Quality Officer at Altman Hospital. Both Altman and Mercy have implemented these robots that we're talking about to disinfect areas using ultraviolet light. How effective are these robots? And then what does the disinfecting process with these actually look like?
So a study that was done by the Texas Biomedical Research Institute showed test results that there was a 99.99% reduction in a pathogen load within 2 minutes of utilizing the robot at a 1 meter distance from a hard surface. And so it's very effective in killing things. However, I want to make sure that we realize that this isn't the only thing that we do. We do this in addition to the standard cleaning processes that we already have in place. And those we test those sites to see how well our cleaning is, and those processes are very efficient as well. So using a robot is something that makes that even more if there's a chance that you may have missed someplace, there's a chance that that robot will kill that as well. So how the process works is, and we were using these before COVID came as well. So how the process does work is, it's not a robot that walks into the room. It's actually something that gets pushed into the room. There's a timer that gets set. You close the door. You walk out and there's xenon UV pulsing lights that occur. And then the surfaces of everything that's there is impacted by that pulse light and it kills those components. When the timer goes off for the amount of time that it takes, and it's usually about 5 to 10 minutes per room, then the operator of that piece of equipment will go in and remove it and then take it to the next location where we're at, or where we want to be able to use those. So we've increased the number of areas where we've been using robots at. But it was something that we're using prior to COVID as well.
So this isn't like Rosie the robot maid from the Jetsons that I remember. Not anything like that. Okay,
They might have names, but they don't quite look like that.
How many robots are used in total, Dan? Going back to you, and where are they used most in the hospital?
If you haven't seen one, it's really great to watch. One of the robots in use, they're on YouTube and everything else. They look like a little R2D2 machine, if you want to think about that. And then when they go to use them, the little head pops up and flashes the light to clean the rooms. Mercy Medical Center has 3 of them, thanks to the generosity of our foundation. They were able to fund 3 of those for us. I believe Altman has 6 robots in use as well. We use ours in our ICU, our emergency department, our OR, the employee break rooms, the offices, the nurses station, every COVID positive room after that patient's discharged, the robots run in that, plus some of our other highly infectious rooms when a patient's discharged, we're using them there as well, like TB and other infectious diseases. And we can use them anywhere in the hospital, really. So we also have a tent that we can put supplies in. So that it's a big tent. It has reflective material inside of it, and we can put wheelchairs, we can put stethoscopes, masks, badges. We can put all that in the tent, zap it for 5 or 10 minutes, and make sure that the equipment that our staff is carrying around is also clean, disinfected as well.
Lori Murtis, as well as Dan Lane. Lori is the Chief Quality Officer at Altman Hospital. Dan Lane is the Director of Quality and Risk Management at Mercy. Both of you, I thank you for the time. I really hope I get to see one of these robots in the future. Maybe I'll see it walking around on the street with a CP or C3PO looking person, as it looks like R2D2. Both of you, thanks for joining me today, and look forward to seeing what you guys do in the future. So thanks.
Thank you for having us.
Absolutely. We'll step aside again. We have the news now, and when we come back, we'll talk about Mercy being back to business and a responsible reopening. What does that look like? Jeff Pike, the Vice President of Physician Relations, Business Development, and Strategy at Mercy, joins us next.
This is Dr. Stan Anderson. You end up having this anxiety about how the world is changing. Be calm. You simply take care of today.
Come on, girls. It's time to take our recyclables down to the recycling drop-off site.
Should I grab these plastic grocery bags too?
Well, sure. They're kind of plastic, so I bet they can be recycled. Drop that bag.
What the heck is that?
There. It is Recycle Man, and I'm here to fight the evils of recycling contamination. Oh, no, you've got it all wrong. We're big recyclers. And while that's commendable, you need to know that this is a bag full of plastic bags and tanglers.
What's wrong with plastic bags and tanglers anyways, Recycle Man?
Plastic bags and other tanglers get tangled in the sorting equipment at the recycling plant. Have you ever tried to remove hair from the vacuum cleaner wheel at home?
Well, he does have 5 daughters. You tell me.
Well, things like hoses, electric cords, clothing, bedding, and yes, plastic bags all get tangled.
But what about the plastic bags we filled earlier with bottles and cans?
Simple, just dump the bottles and cans straight into the bin and take the plastic bags home to use again and again.
Thanks, Recycle Man.
No problem. And remember, you too can be a superhero by recycling right.
This message brought to you by the Stark Tuscarawas Wayne Recycling District.
This is an advertisement. Paid non-attorney spokesperson Ricky LeBlanc, admitted in Massachusetts only. Sokolov Law LLC, Chestnut Hill, Mass. Paul J. Morgan, Winter Park, Florida. Greg Hobby, New Jersey. Michael Bro Gonzalez, admitted Louisiana. While this firm maintains joint responsibility, most cases of this type are referred to other attorneys for principal responsibility. Mesothelioma. If you know what mesothelioma is, you or someone you love has likely been affected by this devastating cancer. You may be entitled to compensation. Call Sokolov Law today. 1-800-736-2100. The only known cause of mesothelioma is asbestos exposure. Thousands of U.S. veterans and trade workers are at risk for the disease. Nearly $30 billion in court-ordered trusts has been set aside to pay money to asbestos victims. If you or a loved one has been diagnosed with mesothelioma, call now. You may be able to receive compensation without ever going to court or filing a lawsuit. Call for a free legal consultation at 1-800-736-2100. That's 1-800-736-2100. 1-800-736-2100.
And now a game of Commercial Chicken, brought to you by Progressive, where we see how long Flo can go without talking about insurance. Ready? Go.
So the weather is just all over the place lately, right? One day it's hot, and the next day it's windy for a while. It's like, make up your mind already. Drivers who switch to Progressive could save big.
Okay, you win. We can't help but save customers money. Progressive Casualty Insurance Company and affiliates.
You've been camping in your backyard, cycling in your living room. You've been enjoying rain showers in your bathroom, campfires on your TV screen. You've been counting stars and birds from your window and holding family cookouts in the kitchen. Now, get ready to go. Go on a real vacation. Take the wheel at your nearest RV dealer or at GoRVing.com.
WHBC AM Canton, trusted, reliable, and part of the community. Brought to you by Friends and Family Credit Union, providing financial needs to all of Stark County. It's time to bring a friend into the family on News Talk 1480 WHBC.
They've been paying out a lot of money. Now they need to borrow. More info on that in seconds. Good morning. Noah Hiles with WHBC News. AccuWeather says today partly sunny and warm, high of 82. It's 75 degrees right now at your severe weather station. Ohio's unemployment compensation well has gone dry. Governor Mike DeWine announced yesterday that the Department of Job and Family Services has a $3.1 billion line of credit with the U.S. Department of Labor, borrowing money to pay unemployment claims for the foreseeable future. DeWine is hopeful they won't need to borrow the full amount. We're a month and a half away from the Hall of Fame enshrinement activities, but what will they look like? Governor Mike DeWine essentially threw a challenge flag at any idea of filling up Tom Benson Stadium during his media briefing yesterday, saying 20,000 people in the stands looks highly unlikely at this time, though admitting we will have to see where we are.
These are the things that, we've talked about all the way through this, that as we open Ohio up and we get back to work and we get back to doing the things that we like, probably the last things that are going to be able to be open are the big crowds.
The hall in response says their planning always involved the safety of spectators at all events. Perhaps it was just overlooked until prompted by recent events. Canton Mayor Tom Burnaby is now able to declare a state of emergency in the city for a pandemic, weather-related damage, civil unrest, or other such event.
Canton has never had that kind of an ordinance in place, and Canton is unique in that we are a statutory city. It's something that we've talked about before. We are the largest statutory city in the state of Ohio, meaning that we are pretty much controlled in large extent by state law.
City Council gave its approval, also voting 11-0 to declare racism at a public health crisis level in the city. The Ohio Community Coalition continues on the road across Stark County, protesting the death of George Floyd in front of Perry High School yesterday afternoon. Monday, they were in Massillon. Meanwhile, Unity Coalition of Canton met again with Mayor Tom Burnaby in what leaders called a productive discussion. More on this later today. Governor DeWine has a press conference again this afternoon, but the subject will be police reform. He'll be joined by Attorney General David Yost and several state legislators. It's this afternoon at 2 here on News Talk 1480 WHBC. Up to $50,000 in reward money is being offered for information that leads to the arrest and indictment of an Akron killer. Summa Health has added $25,000, and the family of Nakia Crawford has tossed in $20,000, both on top of the $5,000 offered by Summit County Crime Stoppers. The 18-year-old was shot dead inside her car near downtown Akron on Sunday. More on this at WHBC.com. Your next news at 11:30 and when it breaks. For News Talk 1480 WHBC, I'm Noah Hiles.
Now, your local weather forecast. Stick with us. News Talk 1480 WHBC.
Here's your accurate forecast. Partly sunny and warm today with a high of 82. Tonight, clear to partly cloudy, low 63. Tomorrow, partly sunny, warm and more humid with an afternoon and evening shower or thunderstorm in spots, high 81. Friday, turning out partly sunny and warm with a shower or thunderstorm in the area, high Friday, 82. I'm Brian May for News Talk 1480 WHBC.
Pass it on. Now's the time to stay apart. Social distancing. Pull together. What's pulling together while we're staying apart? It's calling family to check in on them. It's waving to your neighbor. It's the things we should have been doing all along. And when this tragedy passes and we're able to come together, we'll be stronger than ever because we've already pulled together. Stay apart. Pull together. Pass it on. From passiton.com.
For the latest on COVID-19, stay safe. Visit WHBC.com.
Pass it on.
Trusted, live, and local. Your community. All morning long. Here on 1480 WHBC.
Welcome back into the program today. Healthcare Week rolls on as part of 1480 WHBC's coverage this week of all things healthcare with the COVID-19 pandemic still ongoing. It hasn't gone away, and many questions that still have to be answered this week in different ways. And we're joined by two of the, top institutions within this community, and that is Altman Hospital and Mercy Medical Center. And we bring in now to the show Jeff Pike, who is the Vice President of Physician Relations, Business Development, and Strategy at Mercy. Jeff, thanks for joining me this morning.
Hi, John. How are you today?
Good. I'm doing well. Yourself?
Excellent. Finally got some nice weather this week.
There you go. That's one way of looking at things. So Mercy is back to business. So many people are trying to get back to business, getting back to whatever the new normal looks like. How is the responsible reopening process going for Mercy Medical Center, Jeff?
Well, yeah, you're absolutely right. We are completely reopened at this point. Of course, we're under COVID precautions, just like many other institutions and organizations that we have throughout the country. We've done an awful lot to protect patients and to keep safe. Obviously, healthcare is our business, so we're trained to do so. From the very beginning, we screen patients for symptomology to ensure that they don't have a cough or a fever as they come into our institutions. We're taking temperatures at every door and at every building. That's both in our outpatient and in our inpatient facilities. We social distance in our waiting rooms and have those all marked out so people aren't sitting on top of each other. And we've greatly rearranged our schedules so that patients aren't in queue or in a line, essentially while they're waiting. Our staff and we insist that our patients wear masks. That protects both the provider and the patient as they're receiving care. And we clean rooms. We always did, but we clean them much more frequently now. We clean common areas more frequently. We use solutions that are designed to ensure that our patients remain safe. So I think that we've done an awful lot to ensure the safety of our patients, and I think that's proved out with our numbers and the lack of infections that we've had in our organization alone. So we're absolutely ready for business, ready for patients to come in, and we need to see them and they need to see us. It's time to not put off medical care any further.
As we get to this point, Jeff, the one question that so many people have asked me is they've said, well, what about someone who's suffering from a life-threatening illness, like in that moment at that time?
Sure.
How challenging has that been during this time for somebody who has a heart attack, somebody who has a stroke, to get into the hospital, make them feel safe, to make them feel like they want to come for the healthcare that they need?
Yeah, we've seen similar numbers, particularly in patients that are critical. When they're critical, they've come to us even throughout the entire COVID process, and I think that it's vitally important for them to do so. The patients that I'm even more concerned about are those that have chronic disease, or those that need to be monitored or maintained, or even those that need to be screened frequently in order to ensure that we identify any underlying issues that they have. We certainly don't want patients going months and months without the screening that they need to ensure that they have nothing going on, or seeing their primary care provider to ensure that their care plan is carried out to ensure they don't get sicker. So I've even seen some studies in the nation that believe patients' delay in medical care is going to ultimately be more dangerous than COVID-19 itself was. So in many communities. So, we've done an awful lot. We have robots in the hospital that are utilized every night to ensure that we, disinfect and ensure we have a safe environment. And the precautions that we've put on an inpatient basis really do create a very, very safe environment for patients to come into. Going to see your doctor or coming into your local hospital is a lot safer than going to a grocery store, I can assure you.
Mercy is back to business, as is Altman, and they're joining us today, Mercy and Altman, as part of today's Healthcare Week show. They're combining forces through COVID, and we're joined now by Jeff Pike, who is the Vice President of Physician Relations, Business Development, and Strategy at Mercy. Jeff, you mentioned going to see your doctor. There have been times during this process where I've been like, well, I might have a cold, I might have this, I might have that. Should I go see my doctor? For somebody who's in the same boat as me that's like, I don't want to go see my doctor, why should I feel safe doing so now?
Well, there's many reasons to feel safe doing so, but one of the biggest things that have happened, I think, in medicine, and I hope will continue, is the development of telemedicine and virtual health. Here at Mercy, within our network, we have 10 health and wellness centers, 6 urgent cares, 23 primary care and physician office locations. We've had over 13,000 virtual visits in the last 2.5 months. So it's absolutely been astounding to see people's response to virtual medicine. And I think that's definitely the safest option to do. For the last month, we've been open to inpatient visits at our physician offices. And like I said, we're screening every single patient that comes in. So to ensure that they don't have signs and symptoms of COVID, we're taking their temperature, we're cleaning our waiting rooms, we're social distancing. And I think we've been very successful at ensuring a safe environment for patients who come in, as well as our providers that are caring for them and our staff. So it just truly is vital at this point in time, given that it's been about 3 months since people have felt safe coming in, that they either have a virtual appointment with their primary care provider, or if they have an acute need, like you said, like a cold, that they contact one of our stat cares and come in and get seen for their acute need, or do a virtual stat care appointment, which is available on our website. And, that's absolutely the safest methodology you can do. And we're here and ready to serve for that modality as well.
Well, and that was the thing that I was going to ask you, is that you have those stat cares, you have those health centers that are a bit different. I mean, has this allowed the hospitals to see the importance in having those and making sure that they're well kept? Because now those are becoming more important, right?
They sure are. Providing healthcare in the communities that people live is just vital to your overall healthcare system. And these locations don't just have stat cares; they have radiology, mammography, CT. We have aquatherapy, physical therapy. We have pain services, primary care, cardiology, cardiac testing. I mean, we have services, enormous amount of services that we're putting in the communities that people live in. And I think that being able to get that kind of medical care right in your own community is just vital.
I think it's interesting as Jeff Pike joins us. He's the Vice President of Physician Relations, Business Development, and Strategy at Mercy Medical Center. You mentioned the idea of having these stat cares and making sure that they have all these resources. I mean, medicine as we know it because of COVID has kind of adapted completely over the last couple of months, hasn't it, Jeff?
Oh, it sure has. It's amazing to see medicine and how it's changed. As I said, the virtual platform and all the uses that they have for that are incredible, and the number of patients that are being served by it, and as I actually found it quite useful and convenient. Imagine not having to drive to your doctor's office, but being able to, open up your phone, have a conversation with him or her, and ensure that you're getting the care that you need. Obviously, there's some things that you want to come in for, and we're here and have those modalities as well. We have sleep medicine. We have a musculoskeletal center if you have a sports injury. We just have multiple locations that you can come in that, you need to have physical presence in, and we're ensuring those are safe as well. But it's been amazing to see medicine turn and how virtual it's turned, and to see the patient responses to it. We had less than 1% of our patients not show up to a virtual visit once they made the appointment. So once people make the appointment, they don't have any trouble getting to you afterwards. So it's been neat to see the response and the satisfaction that it's driven in both providers and our patients.
Jeff, can you stick with me here if I take a break?
Absolutely. Love to. Thanks, John.
All right, well, we'll take a break here. We'll come back and we'll continue our conversation on Mercy being back to business and a responsible reopening, as we're joined by Jeff Pike, the Vice President of Physician Relations, Business Development, and Strategy at Mercy. That conversation continues when we come back.
Trusted, live, and local. Your community all morning long here on 1480 WHBC. Breaking and trending. Here's why you should listen. Search 1480 WHBC on Facebook.
It's just good.
Find more right now on WHBC.com.
You probably know that Hartville Hardware is America's largest hardware store with experts to help you design and maintain your home with ease and confidence. Hartville Hardware is also a Platinum Elite status Provia dealer, providing customizable door and window options to add increased value and timeless appeal to your home. Old world craftsmanship built in Ohio, Provia offers a lifetime warranty and Energy Star rating. Count on Provia from Hartville Hardware, your local experts and America's largest hardware store.
Hear residents' thoughts on senior independent living at the Waterford.
When I came, I just felt totally at home. I was sure this was the place for me, and I had no regrets about selling my home. I have never, ever met a nicer group of people.
The Waterford is what I had hoped that I would find, and I found it. Our dinner table is hilarious.
It really is. I have fun every night. I look forward to dinner. I leave here at night, go to bed feeling happy.
No. To me, it's like a cousins. It's just a camaraderie here at the Waterford that is, we just help each other.
We do.
I wanted something comfortable.
Within a couple of weeks, I had a lot of friends. Everyone has been so nice, so warm, so friendly.
At the Waterford, 1 and 2 bedroom apartments are now available. Call Yvonne Herring for more information. 330-966-5643.
Looking for a rewarding career choice? Consider the world of arboriculture. Not all tree work is climbing and cutting. Diagnosis, safety, preventative measures, and treatments are all a part of the world of comprehensive tree care. The International Society of Arboriculture has extensive resources and instruction to help you find a rewarding career keeping trees and their owners safe, happy, and healthy. To find out more or to find a certified arborist near you, visit treesforohio.org. That's trees, the number 4, ohio.org.
Liberty Mutual Insurance Company helps you customize your home insurance so you only pay for what you need. Unlike things you paid for you didn't need, like the Vacnado 2000. A Wi-Fi connected vacuum that uploads Dust Bunny data to the cloud for real-time optimization. Whatever that means. But really, it's just a very expensive doggy chew toy. With Liberty Mutual, get customized home insurance so you only pay for what you need.
Liberty, 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 liberty.
Only pay for what you need at libertymutual.com.
And we return back on 1480 WHBC. Healthcare Week, as part of our program all week that we're having here, we're having discussions about how the pandemic has affected the and two of the main contributors to our healthcare here in Stark County. Really, the two main contributors are Mercy and Altman, the two that have been with us for over 200 years. John Bozica along with you, and we bring back in Jeff Pike, who is the Vice President of Physician Relations, Business Development, and Strategy at Mercy Medical Center. Jeff, we left off talking about how Mercy is going back to business, how physicians are going back to business. I wanted to ask you, in terms of telehealth, which we were covering in the last segment, how much of it was actually utilized before the pandemic? Like, did people actually use it before that time, and how much have the numbers gone up on that?
The answer for us is no. In February of this year, I had not one virtual visit in the entire group. By, like I said, between March, April, and May, we've had 13,000 virtual visits. So both patients and providers really jumped on the bandwagon as far as utilizing telehealth. And in this community in particular, I think that it was eye-opening for both providers and patients as to how useful and easy it is to access.
Part of a telehealth visit, Jeff, for those patients that have never been there for that, I mean, how is it that they're still able to get all of the services they would get in person in a virtual visit? Because it's like I'm used to like the doctor saying, all right, breathe in and out for me, do this, do that. So how are they going to get that same coverage, that same thing, if they're not there in person?
Well, obviously, there's some disease processes or some patients that it's very appropriate for, and there's others that aren't. The ones that it is very appropriate for are particularly those with chronic condition that require labs to monitor, and physicians really can monitor and see a lot of that medication management. They can do an awful lot of deduction from some of those values and seeing, not having to see the patient in person, but just in talking with them through their symptomology. However, Mercy not only provides primary care, we have an enormous number of specialists that we utilize and that serve our patients. And many times our specialists do need to see patients to evaluate for more, acute, more specialized needs. We have 5 general surgeons. Obviously, surgery is a hands-on business that patients need to come in for and that they need to be seen for. We have sleep medicine, which requires sleep testing and an evaluation by our board-certified pulmonologist. Our cardiology, MCI, is both it's a very well-known service that we have here with the highest quality. And cardiologists are clearly going to want to bring you in and have in-person testing done in order to evaluate how you are. If you ever have, shortness of breath or any of the signs, I truly beg, go to either institution rather than trying to hold off because of any fear of COVID. It is vital that you take care of yourself and that you listen to your body and listen to the symptomology that you have when you come in. So, other specialists like rheumatologists, we have Dr. Hannon here, who's an excellent rheumatologist. He can do an awful lot virtually because virtually everything that he works with patients on is based off of lab values and a verbal exam that he conducts. And he's able to medication manage in that way. So every specialty is a little bit different. Obviously, primary care is the easiest use of virtual health. But that being said, in April, 80% of our visits that month were virtual. And now that we've opened up and we're in June, almost 70% of our patients are back to being in-person visits. And I think that, for a large part, virtual visits will probably only remain to be about 20 to 30% of how patients are seen. I think both the physician and the patient like to have hands-on because that's the way that we're used to delivering care.
We've heard it throughout the pandemic. We've said hashtag COVID-19 right now. It's hashtag Healthcare Week here on 1480 WHBC. And we're talking with Jeff Pike, who is the Vice President of Physician Relations, Business Development, and Strategy at Mercy Medical Center. Jeff, I want to ask you, because I've been curious about this. Any medical professional I've talked to, what book actually existed on attacking a pandemic before all of this started? And how have you kind of helped to add to that book so that future doctors have the experience that you now have?
Yeah, there was an awful lot of procedures in place, processes, both governmental, health department, and organizationally. We had prepared almost 8 years ago for Ebola and the bird flu. We've had a number of pandemics that looked like they were going to surface and then just didn't. The one good thing that came out of that preparation is the preparation was still done as far as communication pathways, how the health department would work with our local hospitals and physicians to track patients as they go through. Some of the epidemiologic modeling had already been created years ago. Believe it or not, each of our hospitals had kits from 8 years ago of PPE with masks and gloves and gowns that we were able to access during this because supplies got very short, very quick when this first came out back in March. So I think that, I would never say that America was completely prepared. I don't know that you ever can be prepared because every disease process has a different way of manifesting. Sometimes it can be, it can have a high mortality rate. Luckily, this one didn't. What this one did have is that it's very infectious and people contract it much quicker than they do, say, the flu, which led to a lot of people, getting it and in tight spaces in urban areas and in places where people live together. There's an awful lot of people contracting it at much higher rates than we had seen with other diseases. So I wouldn't say that we're completely prepared, but we certainly were better off due to our preparation of both our government and health officials and our hospital administration. Now, going forward, what have we learned? I think that we've learned an awful lot about what it takes to diminish a curve of a pandemic as it flows through. There's an awful lot of criticism that circulates about our government officials and some of the steps that they have done to shut down businesses and essentially ask us to stay home for a month and a half. And I know the economic impact of that has been pretty damaging. But at the end of the day, what we did see is a lot of lives saved. And I think we learned an awful lot of lessons around what that looks like and what might be necessary should this happen again, and what might not be necessary should this happen again. And to try and second guess people when their entire heart is in saving our public and saving people it's a really challenging job. And to be honest with you, I don't know that I would have made different decisions, and I'm sure whatever decisions I would have ultimately made, would have been blamed for. And there's probably no right decision in some of these things as they come forward.
I would say it's a decision that it seems like no matter what you say, if you're an elected official right now, you're never happy. You're never happy with what's going on.
Yep, I'm so glad to be a healthcare administrator, not a politician right now. That's for sure.
No, I understand you. I got you there. Yeah. Jeff Pike, our guest, the Vice President of Physician Relations, Business Development, and Strategy at Mercy Medical Center. Last question for you, Jeff. Now that we have started reopening, now that we are at this point, how do we in turn prevent not getting back here 3 months from now where we were at the start of March? How do we not go back to the same spot?
Well, I think we've all seen the pictures of people who are allegedly social distancing, and they literally are, just masses of people right on top of each other for whatever reason. I think the very first week that they semi-opened up, I saw a picture from a pool out in Indiana that literally had 300 people in it. So I would implore the public to maintain your social distancing, wear your masks when you go in, wash your hands frequently. Things that you would typically do during flu season, just be a little bit more hyper vigilant. Try and keep the groups that you go to down. I think that we have commercial after commercial and people have heard the messaging. The truth is people are weary of these precautions, and I see everybody, including myself, letting down. I don't think we need to be scared, but I do think that we need to be diligent for the next couple months. Pandemics of the past, particularly those at the turn of the century, really did show that when they reached the level that COVID did, that it dies out in the summer and it comes back in the fall. So if that's any indication of what could happen this time, not only do we need to continue preparing as a healthcare institution, but our public needs to continue being diligent about the precautions that they're taking and prepare to keep themselves safe. If you happen to be a patient that is particularly susceptible, if you're of an age group that you need to be careful with, or if you happen to care for an elderly family member, I think that your precautions need to be even more hypervigilant through these months. The nice thing is the weather's improving. It's great to get outside. I think people have heard this before, but taking a bike ride, walking, doing outdoor activities is fine. Wading into a group of 300 people in a kiddie pool, probably not all right.
Jeff Pike, our guest, Jeff, the Vice President of Physician Relations, Business Development, and Strategy at Mercy Medical Center. Jeff, continue the great work. I really appreciate the conversation today and look forward to doing this again in the future. All right, my friend?
Thanks, John. I appreciate it.
Absolutely. We'll step aside. We just heard how Mercy is going back to work. What about Altman? How are they going back to work and safely doing it to basically live with the ideas that you'll have a safe visit when you go there? Maybe not just in the hospital, but through emergency services as well. We'll discuss that right after this.
Breaking and trending.
Citing signs that the economy is starting to recover from the coronavirus pandemic, Duncan has unveiled plans to hire 25,000 workers in coming months.
The city of Canton signs on to a couple of National Police use of force documents. The mayor is saying the CPD already subscribes to all areas of the 8 can't wait policy.
In a week of protests, there has been no looting, very minor property damage.
Find more right now on WHBC.com.
During these crazy times, it's good to know your local neighborhood pharmacy is here for you. Hi, I'm Tim Kingsbury from Fulton Drugs. Offering drive-through, delivery, and a friendly staff, you can always count on Fulton Drugs and Medicap Pharmacy. Fulton Drugs and Medicap Pharmacy have teamed up to provide you with excellent service. Call us for all of your prescription and over-the-counter needs. We will quickly get you on your way. Fulton Drugs and Medicap Pharmacy, serving the Canton and Massillon areas.
I hate Tom's Tulip Shop. It just smells so flowery. Like we're good at your flower shop. You don't need to remind us.
No matter how hard you work for your small business, online reviewers will find something to complain about.
I needed a fake plant. They don't sell fake plants. Thanks for nothing, Tom.
And while Progressive can't save you from these trolls, we can help you save money on commercial auto and business insurance.
Then he says, have a great day. I'll decide what kind of day to have.
Get a quote online today at progressivecommercial.com. Progressive Casualty Insurance Company, affiliated and third-party
Hey,
insurers.
if you're looking to cut costs and free up some cash on a monthly basis, start today with Pure Talk USA. Now, the average family of four is saving over $800 a year on cell phone service by switching to Pure Talk USA. Now, every plan includes unlimited talk and text. And by the way, it just starts at $20. So switch to Pure Talk today. Just dial pound 250 keyword Pure Radio. Pure Talk USA, simply smarter wireless. You'll have the option to receive a one-time auto-dial text from Pure Talk USA.
Hey, the Roadman Kenny Rohde here, and the Wacom Auto family is here to help you get the car you need. There are a ton of great offers right now at every Wacom location: Ford, Kia, Hyundai, Subaru, Mitsubishi, and Honda. And now more than ever, with everything that's going on in our world, it's important to pick a locally owned, family-operated dealership to get your next vehicle. And Wacom has been in the community for more than 75 years, doing business the Wacom way. You can get unbelievable summer savings right now happening on trucks and all-wheel drive SUVs, plus safe cars and great deals for teen and college-bound drivers. Over 1,000 cars in stock, and you can check them out online right now at Wacom.com. In fact, you can get pre-approved online with no social security number needed, no hard credit pull whatsoever. So take advantage of the summer savings and great deals happening on the Wacom Auto Mile, and do what I did and save the Wacom way and tell them the Roadman sent you.
This is Vern, owner of Verndale's Water Center. Our business is open and following government guidelines. We have convenient curbside service at our location, or call for delivery to your home or business.
Verndale's Water Center.
WHBC AM Canton, reliable as ever on News Talk 1480 WHBC.
WHBC News, it's 77 degrees. He's a graduate of the former Timken High School. Jeffrey Talbert was named last night the new superintendent of the Canton City School District. He has led the Alliance City Schools for the last 7 years. School Board President J.R. Rinaldi says Talbert was their top candidate in previous superintendent searches until he dropped out for family reasons.
He is committed to moving the great work that our staff and community has put into this, moving it forward and committing to it. He's done that at Alliance, and he said, I want people to be excited to come to work each day.
Rinaldi on Canton's Morning News. Talbert takes over for Dr. Jeffrey Graham, who spent a year with the district. Youth in Canton will have 7 places to go this summer as a part of the annual summer program, thanks to $418,000 in federal funding. That's enough money for 361 young people from low to moderate income households, all the way from ages 3 to 18. They'll develop skills and learn positive behaviors. Social distancing is a part of it too. More on this at WHBC.com. As of yesterday, Ohio's unemployment checks are being sent out thanks to the U.S. Department of Labor. The state is borrowing from the federal government now, setting up a $3.1 billion line of credit. Governor Mike DeWine pointed out that other states are being forced to do the same. Just last week, Pro Football Hall of Fame leadership seemed optimistic about a possible game with 20,000 people in attendance. Governor Mike DeWine took some air out of that football yesterday. The governor was asked about having a full house at Tom Benson Stadium in August.
Having a crowd that size, I think, is highly unlikely. Certainly, it could not occur today. It would be very dangerous to do it today.
The hall, in response, says it has always been their goal to hold events in a safe manner. The state says it's been working with the enshrinement event organizers on the possibilities. Your next news at noon and when it breaks. For News Talk 1480 WHBC, I'm Noah Hiles.
Your severe weather station, News Talk 1480 WHBC.
Here's your accurate forecast. Partly sunny and warm today with a high of 82. Tonight, clear to partly cloudy, low 63. Tomorrow, partly sunny, warm and more humid with an afternoon and evening shower or a thunderstorm in spots, high 81. Friday, turning out partly sunny and warm with a shower or a thunderstorm in the area, high Friday, 82. I'm Brian May for News Talk 1480 WHBC.
I set your alarm.
Kim's Morning News with Pam Cook. Have your phone with you? Of course you do. You can listen to us anywhere, anytime on your phone. How? Go to WHBC.com, the iHeartRadio app, TuneIn, and radio.com.
If I can't listen to you live, I always go to the podcast.
Hey, Alexa, play 1480 WHBC.
That's where everyone goes for local news, weather, and traffic.
News Talk 1480 WHBC. We go where you go.
WHBC.com. Trusted, live, and local. Your community all morning long here on 1480 WHBC.
And we return back on 1480 WHBC. John Bozica along with you. Hashtag Healthcare Week. As we've done all week so far. Monday we were at Hearing. Yesterday at Omni Orthopedics. Today we're at the station. You can view us either on Facebook via our StreamYard service, or you can, in fact, listen on 1480 WHBC. I'm sure many of you are even doing both at this point. And we bring in our next conversation now. Altman going back to business, reopening, and the importance of returning for critical care. Ron Maines, the Director of Cardiac Quality at Altman, joins me right now. Ron, thanks for joining me this morning.
Hi, John. Thanks for having me.
Absolutely. So, I know that COVID-19 has had an impact on Altman itself. It's had an impact on the entire healthcare industry. But what are you seeing in terms of the effects of people in the community and their health?
Sure. You know, the health community has been impacted directly by COVID infections, obviously. But there's also been an indirect effect in how COVID affects other health issues. Data put out by the American Heart Association showed that fewer people called 911 between January and mid-April. And that amounted to 29% decrease in 911 responses, 31% decrease in heart attack and chest pain cases, and also about a 20% decrease in stroke cases seen. So, and also of note, about 40% of the people that were hospitalized with COVID-19 also had cardiovascular disease or stroke. So the greatest risk those at greatest risk for complications were people with coronary heart disease, hypertension, stroke survivors, people over 65, and people with diabetes. So our cardiologist even had commented that the number of people having heart and stroke events likely didn't decrease in the community, but they just weren't seeking care. So as a result, we have seen more cardiac arrests and deaths after delayed presentation to the hospital.
What is going to allow that to truly change? I mean, if people aren't calling 911 and getting the treatment, what's going to allow that to change? And why do you think that is that people aren't calling at this time?
Well, along with the COVID-19 pandemic, John, we are experiencing record unemployment. So this may mean that people have lost their health benefits as well. So they might be making decisions whether to seek care based on their ability to pay for it. There may also be a perceived safety issue. Maybe people are a little bit more afraid to come to the hospital, thinking that they may be more at risk of being infected. So they minimize the importance of the symptoms that they're experiencing. You kind of hinted to what's being done, I think is what you were getting at. Is that right, John? To sort of alleviate fears?
Yeah, absolutely.
Well, at all locations across Altman, and I know Altman and Mercy have been working together on all of these COVID-19 interventions, but screening and hand washing stations are at every entrance. This means that everyone entering the facility gets their temperature checked, as well as is asked about symptoms. and that means all visitors too, not only employees and patients, but visitors as well. Mask requirements are in place for all facilities, so that means employees, patients, and visitors are required to wear masks during or inside all of the facilities. Visitors, if they do not have one when they present, they will be given one on arrival. And as discussed earlier, I believe in the talk, there are visitation restrictions now in order to limit the number of people moving about the facilities, creating these potential contacts and raising risk. Also, of course, rigorous cleaning and sanitizing protocols have been in place between each patient and each use of equipment. This even includes the use of ultraviolet robot technology for deep cleaning.
So, in the event now that because people didn't seek that care during the COVID pandemic, which is still ongoing, obviously, Ron, but as Ron Maines joins us, I want to say who he is again. He's the director of cardiac quality at Altman. Since people maybe haven't been going to receive that care, has Altman been getting ready then to receive additional patients who may have heart disease or something to do with a cardiac issue at this time?
Well, we have been getting ready, and one of the main messages I'd like to get out there is that it is safe to call 911. And I want to reiterate that the hospital remains the safest place to be if you are having heart and stroke symptoms. Okay, there's no question. In fact, if I can take a moment, John, to just review the heart attack and stroke symptoms, is that okay?
Yeah, go ahead. Absolutely. Okay. That's completely fine. I assume that I'm saying yes. Sometimes we don't connect back and forth, but yeah, that's perfectly fine. Go ahead.
So heart attack symptoms, chest pain is very well known. However, any discomfort between the level of the nose and the navel, such as discomfort in one or both arms or the upper back or upper abdomen, can be a sign of a heart-related event. Other symptoms are shortness of breath, unexplained sweating, nausea or vomiting, even lightheadedness or palpitations. Now, the signs of stroke can be summarized with the acronym FAST, F-A-S-T. So the F stands for facial droop or numbness. The arm would represent, or the A would represent arm weakness or numbness. The S would represent speech difficulty, whether that's slurred or garbled speech, or even just the inability to produce words. And then T, of course, is time to call 911. So any symptoms for heart or stroke events, definitely want to call 911 and get into the hospital.
Ron, the one thing I wanted to ask you, because I think this is an interesting topic during this time, is that a lot of people have heightened anxiety during this time. And oftentimes panic attacks, anxiety attacks can mirror some of those things. I mean, they really can. So if you're somebody that is experiencing that, how can you easily, I guess, decipher the difference when you may not understand exactly what's happening? What can you do in that case?
Sure. That's a great question, John. I've had that question a number of times over the years from my patients. And, heart attack symptoms tend to have certain characteristics. They'll last minutes rather than seconds or hours, and they also tend to recur. They come back again after they go away for a short periods of time. But definitely one of the things to do is call your practitioners, your providers, your healthcare providers, and you want to keep regular appointments with them and make sure that you're seeking help early. Oftentimes you can prevent a call to 911 by seeking help at the first sign of an issue. The American Heart Association does like to promote the fact that heart attacks often have a long ramp up of warning symptoms. Most patients most patients don't have the dramatic, sudden, onset of symptoms. They will have warning signs. If I dig when I ask after the fact, I can usually find that these patients were having warning signs for even months before the event that finally brought them to the hospital. So I think it's really important for people to pay attention to the symptoms that I mentioned and seek care early. There's no question that people who seek care early when they're having a heart or stroke event have better outcomes than those who wait.
That's Ron Maines who's joining us. He is the Director of Cardiac Quality at Altman Hospital. Ron, another question for you here. At the beginning of the COVID-19 crisis, access to preventative and follow-up care was really limited. What can patients do to stay safe and healthy as the community continues to find a new normal for life right now?
Sure. Well, as I've already mentioned, keep your follow-up appointments and keep your regular scheduled appointments. As was brought up earlier, a lot of those are being conducted through telehealth now. So they're done remotely using digital apparatus. That will continue to happen moving forward. So that certainly is a safe way to seek care. But also the basics. We can't reiterate this enough. You want to keep washing your hands regularly and often. Keep wearing a mask in public when you can. And obviously social distancing remains important moving forward. Trying to reduce the potential contacts and potential touch points where the COVID-19 can be transmitted from one person to another. The more layers of protection we can put in, like the three I just mentioned, the more we reduce the risk of transmission.
Well, and I just wanted to get this one last thought in here with you, Ron, that I think the one last thing that I wanted to bring up was that people have talked to me a lot about how if you get COVID, oftentimes it can have effects of morbidity on you in terms of like you can get a heart attack, you can have a stroke, you can have those things happen. When you have COVID, what things can you do in that time then to make sure if you get it, that you prevent yourself from having those maybe underlying factors as you move forward? Are there things you can do?
Well, the most important thing is being in really strong communication with your healthcare providers. Oftentimes we'll see that people will be so focused on the particular thing that brings them to the hospital that they may not disclose certain health history information that's crucial to understanding the total picture that's going on with somebody. So definitely want to make sure you let your practitioners know that you do have certain risk factors. Don't hold back. Sometimes people are embarrassed to talk about certain things. So you definitely want to be honest and be sharing your risk factors that they're asking about, whether it be the diabetes history and family history that you've had. Sometimes under crisis events, it's even hard to not remember those things sometimes. Often patients will be a little discomforted by the fact that they get asked the same questions repeatedly throughout the healthcare system. And there's actually a little bit of strategy to that. It's because we often get different answers along the way because when you're faced with crisis and, as you mentioned, anxiety, sometimes you just don't think of everything you need to think of in the moment. And as things calm down and you move through the healthcare system, you can think a little bit more clearly about your history and events that that might be important to a practitioner rendering care.
Well, I'm glad, Ron, that we don't put the hand on the Bible and tell people to not perjure themselves when they're going through the medicine system. Ron Maines, Director of Cardiac Quality at Altman. I appreciate the time this morning, my friend.
Thank you, John. Thanks for having me.
Absolutely. We'll step aside one last time, come back and wrap up today's Healthcare Week show as we've combined the forces of Altman and Mercy through the pandemic, working together to keep you healthy in Stark County. We'll wrap this show up and tell you about what's to come tomorrow when we come back.
Trusted, live, and local. Your community all morning long here on 1480 WHBC.
Hartville Hardware wants you to win $1,000 with Sourcebook. Fill out the official entry on page 11 or send a postcard with your contact information to Sourcebook, 550 Market Avenue South, Canton 44702. Entries must be postmarked by July 31st. Winner drawn August 5th. Visit WHBC.com for a list of pickup locations. The 2020 Sourcebook, your source for $1,000 cash, made possible by Hartville Hardware.
Start your addiction recovery journey from anywhere with ComQuest Telehealth Services. Recovery services are needed now more than ever. ComQuest is here to help, and your safety is our top priority. Our dedicated staff will start you on the path to services that will best meet your needs. Your recovery matters. Start your recovery journey today with ComQuest Telehealth Services. Call 330-455-0374 or visit us at comquest.org. That's COMMQUEST.org for more information.
As we begin the road to recovery, Discount Outlet in Canton and Massillon are ready. While we still have great deals on essential cleaning and paper products, Discount Outlet also has some amazing closeouts on outdoor activity items from golf, baseball, softball, fishing, and even some great picnic food and games. See for yourself why tiny prices are a big deal at the original Discount Outlet on 1st Street in Massillon, and check out our newest Discount Outlet in Belden Village.
Discount Outlet, where tiny prices are a big deal.
And now a game of Commercial Chicken, brought to you by Progressive, where we see how long Flo can go without talking about insurance. Ready? Go.
So the weather is just all over the place lately, right? One day it's hot, and the next day it's windy for a while. It's like, make up your mind already. Drivers who switch to Progressive could save big.
Okay, you win. We can't help but save customers money. Progressive Casualty Insurance Company and Affiliates.
Ready to take on that painting project? Ask Sherwin-Williams and get 30% off paints and stains with sale prices starting at $26.94 June 19th through 30th. With 30% off our exceptional paints and stains, you can give some color love to your bathroom, living room, or every room in your home. Shop in store or order online for curbside pickup. Retail sales only. Some exclusions apply. See store for details.
Trusted, live, and local. Your community all morning long here on 1480 WHBC.
We thank these two community institutions, both Altman Hospital and Mercy Medical Center, for being part of today's program and making today possible for us to have this conversation about health with you and make sure that we tell you what you need to know and give you an upfront look from the two institutions that lead medicine here in this county. I mean, two institutions that, again, they've served the community for more than 200 years. When you really think about that, that's amazing. Altman Hospital, almost 130 years, and then Mercy Medical Center, about 112 years. And the fact that through all of this, through this time now where there's been a pandemic, that they are combining forces and they've been a part of, what's been so integral to our safety, our health, and everything in between. And the amount of people that they employ, which has been such a big thing during this, is people having a job. They really are fabrics of this community. They're fabrics of what we do in Stark County. And you can't say enough about that. And, really proud to be a part of this today, proud to be a part of this with them. Something that I think you needed to hear at this time. And I think that's the key, is that you needed to be a part of this discussion. You needed to hear from all of these people, and you needed to know that your healthcare system here in the county is working for you. I mean, it's working for you in a number of ways, and it continues to do that each and every day. And if you ever question that, I mean, you shouldn't. Every doctor, every person working through the pandemic has constantly had the best interest of the people. And I applaud both Altman Hospital and Mercy Medical Center for doing this, for doing something that is so outside the box like this, for two things that so many people look at and they consider them to be competitors. The fact that they set that aside and they said, look, this isn't about us. This is about the community. This is about serving the people out there. that's just, it speaks volumes. It really does. So applaud your healthcare workers, applaud the people who are on the front lines, because they truly deserve so much credit for what they have done throughout this entire time. Well, that's just going to about do it for us today. I want to thank all of those that were part of the show again one last time today as we go through the list, both Chris Remark and Tom Strauss. Chris is the CEO at the Altman Healthcare Delivery System, and then Tom is the CEO at Mercy Medical Center. We thank both from the nursing wings, Ann Gunther, or Annie Gunther, say Ann Gunther, and Barb Yingling, both chief nursing executives at Altman and Mercy. Chris Parrish and Brian Conklin, both with the personal protective equipment. Lori Murtis and Dan Lane with the sanitizing units. Then Jeff Pike, the vice president of physician relations, and Ron Maines from Altman, who was the cardiac quality person there. Tomorrow we'll be at Green Compassion Network discussing this with you and talking about a branch of medicine that a lot of people have kind of been, I guess, scared to have the conversation about. Looking forward to being out there tomorrow and being a part of that conversation. Until then, Healthcare Week continues. We're glad we can bring this to you every year on 1480 WHBC. And one last time, we thank Altman Hospital and Mercy Medical Center here in Stark County for being the backbone of our healthcare system. I will talk to you tomorrow morning at 10 a.m. Till then, have a great day and stay healthy.
Upgrade your tools and get 11% off everything now at Menards. All Bosch power tool accessories are 11% off. The versatile Bosch 18-volt 2-in-1 impact driver accepts both standard drive bits and half-inch sockets. It